Assalamu alaikum. My name is Al Hassan Al Ali and I will be talking about pulmonary embolism. Now, what is pulmonary embolism? Well, there's a process within the body that's known as blood clotting, and it is a normal process to prevent bleeding. The body makes blood clots and then breaks them down. However, there are circumstances in which the body is unable to break down those blood clots. When that happens, the embolus can move throughout the blood vessels and it is now called an embolus. So the embolus moves through the veins, it enters the right ventricle of the heart, and then it goes into the pulmonary arteries, one of the pulmonary arteries. And so when the blood clot enters one of them, it can get stuck there. The action of the embolus getting stuck in a blood vessel is known as embolism. And since the location of the embolism is in the pulmonary arteries, you get the term pulmonary embolism. In simple terms, pulmonary embolism is the blockage of a pulmonary artery. Well, the question now is, what happens when a pulmonary embolism occurs? Well, in the lungs, you have what is known as gas exchange between the alveoli and the pulmonary capillary. The oxygen from the alveoli goes into the oxygen-carrying blood, and the carbon dioxide goes into the alveoli to be exhaled. When the pulmonary artery is blocked, there is less blood moving through the pulmonary capillary to carry oxygen. The ventilation is normal since the alveoli continues to have oxygen, but the perfusion is decreased since there is less blood. The ventilation-perfusion mismatch eventually leads to hypoxemia, and in severe cases, it leads to pulmonary infarction, which is the death of lung tissue that is caused by a lack of blood supply. And with the pulmonary infarction, you also get alveolar atelectasis and alveolar consolidation. Now let's move on to what puts you at risk of pulmonary embolism. The risk factors are venous stasis, which is the slowing of the blood flow of the veins, hypercoagulation, which is the increased tendency of blood clots to form, injury to the endothelial cells that line the vessels themselves, and also other risk factors such as obesity, smoking, family history of pulmonary embolism, and trauma. The venous stasis, hypercoagulation, and endothelial cell injury are known as Virchow's triad, and they are associated with deep venous thrombosis. Deep venous thrombosis in the lower legs is the main cause of pulmonary embolism. Normally, the veins are able to move blood back to the heart with no problems, but because of factors such as Virchow's triad, you get deep venous thrombosis, which is the formation of blood clots in the lower body. And like I said earlier, these blood clots can move through the veins, enter the right ventricle of the heart, and go into one of the pulmonary arteries. However, there is a worst-case scenario in which the blood clot does not go into the pulmonary arteries but gets stuck at the bifurcation of the pulmonary arteries, right where the pulmonary trunk separates into the right and left pulmonary artery, and it is known as a saddle embolus. It quickly becomes fatal as it not only causes hypoxemia, but it significantly decreases the amount of blood that goes into the left ventricle to be distributed back to the body. Basically, it means that it will cause heart failure. Now, there are also embolism that, other than blood clots, such as air embolism, fat embolism, amniotic fluid embolism, which is seen in pregnant women, bone marrow embolism, and trauma. I've now talked about what pulmonary embolism is, its risk factors, and its causes. Now it's time to talk about its symptoms and signs. The signs and symptoms of pulmonary embolism are not clear and can be misleading, so it's up to the practitioners to raise suspicions on there being a possible pulmonary embolism case. However, the symptoms of the patients with pulmonary embolism can be a weak pulse, hypotension, the swelling of the legs, meaning deep venous thrombosis, shortness of breath, coughing, blood sputum, chest pain, and cardiac arrhythmias. Let's say that a patient went into the hospital with these signs and symptoms. How do practitioners diagnose the patient with pulmonary embolism? There are many tests available, but the go-to test nowadays is the computed tomography pulmonary angiogram, as it is very easy and quick. The chest x-ray isn't useful for diagnosing pulmonary embolism as it does not show up on the x-ray, but it can be helpful in looking for suspicious findings. You also have the pulmonary angiogram and the ventilation perfusion scan. if needed. The D-dimer blood test is a test that is useful in seeing whether there is a possibility of there being pulmonary embolism or not. If the number that comes back is more than 500, that means it is abnormal, there is a possibility of there being pulmonary embolism, but it is not specific to it. Now lastly, we have the management of pulmonary embolism patients. Once pulmonary embolism is confirmed, patients are put on heparin right away, which is a fast-acting anticoagulant, and it is most likely going to be low molecular weight heparin than high molecular weight heparin, as it is easier to treat with. The heparin is used to prevent the blood clot from growing and to stop other blood clots from forming. Then warfarin is added with the heparin, as it is a slow-acting oral anticoagulant. You also have thrombolytic agents such as streptokinase, which can be helpful in the treatment of acute pulmonary embolism. However, it should be noted that it is contraindicated in patients with unstable blood pressure. Walking, exercising, drinking fluids, and compression socks are measures that are helpful in preventing pulmonary embolism in patients with high risks. As for the respiratory care practitioners' management for pulmonary embolism patients, they give them oxygen therapy to treat the hypoxemia, and lower the work of breathing, as well as giving aerosol therapy to help in the cases of bronchoconstriction. Thank you very much.